A lot of people in our community say that, they've seen this episode before,
Mhm.
i.e. Tuskegee, right?
Mhm.
So
Mhm.
I think it would be helpful for either Dr. O or Dr. Morgan to, one, educate people on what Tuskegee was and what it was not, and how that is different than what we are experiencing now with COVID.
Well, Tuskegee started out as a research study. And
Mhm.
so that's entirely different from what's happening now. What we have on our hands now is a global pandemic of a virus that is devastating the community. The Tuskegee study started out as an experiment, and as you know, Andrew, um, when it went off the rails is because the research was being done to treat black men with syphilis, and it became clear halfway through that penicillin is actually an effective way to treat syphilis, and a decision was made not to disrupt the study and so to continue not treating some people, and that was unfortunate and certainly not something that could happen today, and it's one of the things that's left a bad taste in the African American community about research. But the problem we have now is not research. It's an actual disease that's out here that we're trying to fight against. And one of the best tools that we have to fight against an infectious disease is a vaccine. And we can look back at the successes that we've had with vaccines against other viral diseases, against smallpox. Chanel mentioned, you don't see smallpox anymore. Why? Because we have a vaccine. We don't even we've done so well with smallpox that we're not even vaccinating anymore. It's gone pretty much. Measles, all the vaccines that we got in childhood are tools that we have in healthcare to fight against infectious disease, and that's what we have now. We have an infectious disease, a pandemic that's out there, and we luckily or skillfully have developed a vaccine against it, and we just need to get the vaccine out there to as many people as possible, as quickly as possible, so that we can begin to manage this epidemic. And as Dr. O says, get our lives back to normal, right?
Mhm. Yeah, and I always try to use this opportunity just to say the name of the study so that people remember that it's the Tuskegee study of untreated syphilis in the Negro male. That's the name of the study, and so that we don't that we're not mixing that up with Tuskegee, the institution, which is a historically Black university that is known for its excellence and that it has done a lot for the Black community and it has produced a lot of Black doctors. And so I would just like to say that so people understand, so that we're not using the term synonymously. Sometimes we do. But as Dr. Morgan said, that study was really different. There was a lot of ethical problems with it, obviously, which is that people who had a disease were not given treatment when they could have been treated. That's a really big problem. In contrast, what we're seeing now in this global pandemic is a readily available treatment, or a preventative tactic. That's what a vaccine is. A vaccine doesn't treat the disease, but something that could potentially prevent people from getting it. Something that we've all been hoping for, right? Now it's available in our communities, and now the choice is really up to us about whether we want it or not, right? And so it's actually not, it's our decision to make, but I'll just echo what Dr. Morgan said, and something that I hear a lot from other people who are doing this work is that if a lot of people don't get from maybe to yes, our communities are going to be left behind. And what we're all worried about is where that'll really ultimately leave us as a community, as a Black community, right? If other people are getting vaccines and our community isn't. And so I've been really harping on that. You don't have to say yes today, but I think every conversation that you listen to, you continue to ask the question, so you figure out if you're really saying no, how can we answer your questions to get you to move towards a place where you're comfortable, so that you're not part of the people who are left behind. And I think that's ultimately what we're out here trying to work on.
Absolutely. I really appreciate that. One, that historical perspective from both of you. Very helpful. Chanel, let's kick it over to you. There are historically been things that have, marginalized communities of color and specifically African American men and women. And so, why do you think there is so much hesitancy from clients? Well, do you think that is part of the reason why there's so much hesitancy, or maybe are you hearing other things from your clients?
No, I think that one of the biggest stories is the Tuskegee experiment that Dr. Michelle and Dr. Morgan talked about, and I'm glad you asked the question and you asked them to explain it. Explain the basis of it and the historical presence of it, because people come into the barbershop and they don't know. The first thing they say is, "Oh, the Tuskegee experiment," and they're not educated and versed on actually what happened. Like Dr. Morgan said, this is a global pandemic. That was an experiment. And now, when you look at the medical field, I'm quite sure with things that have happened, with Henrietta Lacks at Johns Hopkins, using her cells, the Tuskegee experiment, all those things, and I can understand why Black people will say, hey, they mistrust, with the medical system. But at the same time, when you look at that and when you do that, again, we put ourselves so far behind without really knowing the true education of it all. So people coming into the barbershop, they're hesitant, cool. But I think one of the things that we need to look forward to in terms of solution is diversity. Diversity in the medical field, diversity in healthcare, period. And when I say diversity, I'm not just talking about Black faces in medical schools. I'm talking about Black faces in clinical trials. When you look at COVID and, when you look at the clinical trials, how many people of color were in those trials? I mean, yes, we can sit back and complain and say, hey, we're not represented, but are we stepping up? And again, I understand because of the history, we don't want to step up. So it's like we're kind of in this bag, but we have to get out of the bag so we can begin to be represented in these trials. So it's not just saying that this will be treated, and it's more focused toward people of non-color. So I would say, diversity in the schools. And when you look at even medical school now, there's a huge decline of Black faces in the classroom. And this goes back to the streets, goes back to the myths, it goes back to the mistrust. So now you have individuals who are kids, like, I don't even want to be a part of it. That's not for us. That's for the other people. But look how much we lose. Because we're not being diagnosed, right? It just puts us so far behind. So I would say diversity. Diversity is key in every aspect of healthcare moving forward. And I think COVID just shined a light on something that has been, sort of kind of under the cover. But we're having conversations about it, and that's what we're doing right here.